Sedation dentistry. I mean, you're big on sedation. Like, what are the procedures that you're frequently doing sedation, and who's the typical patient?
Yeah, so typically we have two types of patients. We have the dental phobic, the person who's so deathly afraid of the dentist that they haven't been in 15, 20 years, and it's fantastic for them. We transform their lives because they're able to get their dentistry done. And then the second patient is that busy person, the mom who has, 6 kids like my wife.
Okay.
And they don't have time. In fact, my wife's a perfect example. She puts the kids, she puts everybody else first and doesn't get her dentistry done. These women, these busy women, they want to get all of their dentistry done in one visit. They don't want to come.
And that's what sedation allows you to do? Just because they could be there longer?
Yeah, and we have the same day crown machine called CEREC.
Oh, really?
We can basically sedate someone, do 4 or 5 crowns, they wake up with their permanent crowns. There's no after visit to take the temporary off and put the new crown on. People love this. They get all of their work done. Fillings, extractions, crowns, all in one visit. That busy professional that doesn't want to take off work, it's more expensive to take off work than it is to spend a little bit more money, do the sedation, and get it all done at once. We'll have people that in one person's office will do 1 crown. In our office, they do it all because they just want to get it done. They want to get healthy, and they, best of all, don't want to remember the whole process.
I have dentists that have been on this show, and they go, Randy, with good bedside manner, listen to the patients, you don't really need sedation.
Yeah.
Do you think that's insensitive?
I
They don't get it? Because look, even on a teeth cleaning,
Yeah.
when I got nitrous, it was like,
better.
now I'm hooked on nitrous forever. It's like, it was fantastic.
Yeah.
But do you think that's insensitive of a dentist that thinks that just bedside manner alone?
Well, here's the thing. These dentists, they don't see the people we see. And
Okay.
the people we see, they do not come into an office unless it says IV Sedation Dentistry.
Oh, okay.
They're searching us out. They'll drive for hours to come see us because they don't want to go to that person because it's a Russian roulette. They don't know if that person's going to have good bedside manner or not. So they just don't know. And I didn't know. I was one of those dentists before I got trained. I didn't realize the people that would come out of the woodwork. I would say 50% of the population regularly goes to the dentist. The other 40 to 50, they don't go. General dentists, regular dentists don't see them unless they're in so much pain that they have to go in, and then they white knuckle it. We're the ones that get those people. They drive for hours to come see us because they know we have a solution.
Is this true of some people? I mean, they have all this dentistry done and they kind of wake up at home
Yeah.
and they don't remember the procedure?
Sometimes they don't remember the whole day. Now they're conscious. They'll be talking to their spouse and asking questions. They'll ask the same question 4 or 5 times throughout the day. Well, did we get it done? Are we done yet? Or have we gone?
Really?
They just don't remember. And it's people who didn't even know that they wanted that, they transition to, if they need anything invasive, crowns, fillings, they want to do it under sedation. Get it all done in one visit.
So less than like 5% of all general dentists even do IV sedation.
Yeah.
Knowing what you know now, could you ever go back? I mean, if you had to not do IV sedation, it would be tough?
I would give up my career, honestly.
Really?
As a dentist, you have to look at it. I've heard the statistic, whether it's true or not, I don't know, but dentists have the highest suicide rate. I mean, imagine being in a profession where no one wants to come to you. That to me is torture. I get to work on people that are so grateful that I can do IV sedation on them. I free them from their captivity of feeling like they can't get work done. Like they bring me cakes, they bring me cookies, they bring me Laffy Taffy. Are you allowed to bring the dentist sugar in your state? Is that legal? Can't do it here in California. They just want to give back.
Nice.
They want to give back because we've freed them from their fear. And sometimes they turn a corner. Once they realize that they can trust us, these people won't even walk in the door. I've had to go out and meet them in their car. They're so afraid. They need to meet me in their car before I can even see them. Once a year goes by, we've done a couple sedations, we've got them all healthy, they're in there getting their teeth cleaned. No longer crying, no longer afraid, because they know that we're trustworthy. They know that we're not going to hurt them. And that if they raise their hand, we can stop and figure out what's going on. If they need to tip up, take a breath, that's fantastic. I love seeing those patients that no longer require that. But if it's needed, they know it's there.